Hi everyone, thank you for checking this video. I'm Bruno Messen. I work at WHO Geneva in the Health Financing Unit. This work is being done in collaboration with Megumi Rosenberg, Grescu and Inke Matauer. So this recording is about a Delphi survey that we are about to launch, and we would like to invite you to participate as a panelist. It will be about quality of chronic care and more specifically conceptualizing and specifying the possible contribution of purchasing arrangements. NCDs are the leading cause of mortality and morbidity worldwide. 82% of premature deaths occur in low and middle income countries. In these settings, health systems' response has been deficient. Health centers, for instance, are still mainly tailored to handle mother and child health or communicable diseases. NCDs are about chronicity. They can be lifelong. They require other capacities at provider, facility, and system levels. So many low and middle income countries will have to reconfigure their healthcare systems for persons living with chronic condition. As an example, you need a digital system which allows longitudinal follow-up of patients. Some health financing policies are also more supportive than others to this much-needed transformation of the healthcare system. At WHO, we look at health financing issues with a system perspective. We adopt a functional approach. These functions, resource mobilization, pooling, and purchasing, prevail in any health system. So they are really the loci where policy choices are to be made. The system perspective also entails that there is nothing such as a health financing system for malaria, TB, HIV, or NCD. Still, chronic illnesses do require other service delivery models than acute care. So a good understanding of issues with quality chronic care is an important background knowledge for health financing experts contributing to policies. The health financing function of focus for the Delphi survey will be purchasing. Purchasing should not be confused with procurement of medicines, equipment, and so on. Purchasing is the allocation of pool funds to healthcare providers for the delivery of health services on behalf of certain groups or an entire population. We will refer to purchasing arrangement, which is any institutional arrangement that supports allocation and channeling of funds from a purchaser, like a social health insurance fund, a Ministry of Health, to a provider for the provision of health services to reach a health objective. Providers can be patient groups, like peer educators, individual health workers, like a GP, health facilities, or networks of health service providers. A key purchasing arrangement is what we call provider payment mechanisms. There are indeed different ways to finance health facilities: capitation, fee-for-service, case-based payment. All these mechanisms have pros and cons in terms of the incentives they set to providers. Wrong choices, wrong combinations can lead to inappropriate behaviors like over-prescription of tests or underinvestment in the empowerment of patients. Over the last decades, there have been new developments, new models. In high-income countries, they are called pay-for-performance, bundle payment, often with a focus on the chronic illnesses. In low and middle-income countries, models have been also developed, like performance-based financing, yet so far with little attention to chronic illnesses. So there is really a question: are all these mechanisms relevant for settings like those we have in low and middle income countries? For those of us involved in the design of new payment mechanisms, there are a few issues to keep in mind when we deal with chronic illnesses. And this will be part of the focus of our Delphi survey. We need to know the needs of people living with chronic conditions in low and middle income countries. We have to take into account the health service delivery context. We have to clarify what we want to pay for, determinants, outcomes. We have to keep in mind the limitations of payment mechanisms, the requirements for the theory of change to work. And more fundamentally, we have to keep in mind that these payment mechanisms are not the main way to improve quality chronic care. And so we have to think about the interactions with the payment mechanism and with other interventions, like, for instance, quality assurance programs. This program of work of WHO is organized in 4 steps. As a first step, we commissioned a literature review to Grescu and her team of papers conceptualizing quality chronic care. As a second step, Grace developed a quality chronic care framework. We are now at the third step, the Delphi survey. We take the framework and we try to calibrate it to the specifics of the purchasing arrangement, theory of change, in the context of low and middle income countries. The survey will be organized in 2 rounds in February and will involve experts from the 6 WHO regions. With the knowledge created thanks to the Delphi survey, we will produce a background document for a global report to be edited by the WHO Center for Health Development in Kobe, Japan, and the OECD. For this Delphi survey, we are paying attention to the composition of the panel. Some of you are clinicians working in hospitals or in health centers. Some of you are researchers, some of you are policymakers, program managers, some of you work for NGOs, for patient groups, some of you may live with a chronic condition. All these perspectives matter for defining quality chronic care and understand what we can do about it with provider payment mechanisms. These are the different steps of your involvement in the Delphi survey. First, we need a formal confirmation from you. Then you will receive an invitation to complete your declaration of interest for WHO. You will access the report and video produced by Grace on her framework. We will invite you to attend at least one of the live briefing sessions. We will organize more than one as you are distributed on the globe. Then you will be invited for the first survey. We will analyze the data, the knowledge generated, and then we will come back to you with a second survey. At WHO, we see this program of work as a journey. Healthcare service delivery models for chronic care will keep us busy for the next decades. So for us, it matters, of course, that you bring your expertise to our Delphi survey, but we also value a lot the bonds that we will develop with all of you through this program. So yes, let's try to create this community of expertise around this agenda. I hope I was clear with this presentation. Do not hesitate to contact us if you still have questions, and we hope you will be with us for this Delphi survey. Thanks a lot for your attention.